Hi, everyone, and welcome to this webinar on positive learning outcomes within recovery interventions in the times of COVID-19. We are very happy to see you all here today. Although we cannot see all of your faces, I see your names, and I hope to hear from you in the chat box in introducing yourselves. We're quite the team of partners working on this event, and I have the honor of working besides these people. We're happy to jointly organize this webinar with EURAD, Run, Celebrate Recovery, Patrignano, Narcotics Anonymous Sweden, Projecto Hombre, and the European Federation Therapeutic Communities, together with us at WFAD as part of our recovery webinar series. A special thank you to my colleague Cressida, who will be working behind the scenes today and who has been instrumental in planning and setting up this webinar. My name is Regina Mattsson. I represent the World Federation Against Drugs, and I'll be your moderator for today. WFAD is a membership organization with NGOs and individuals from across the globe. With our now 299 member organizations in 60 countries, our aim is to prevent drug use, increase access to treatments, and to promote recovery. If you would like to make history as our 300th member organization, you're welcome to get in touch and apply via our website. So to get us started, I will lend some words from one of our partners, EURAD. The COVID-19 pandemic has, as we know, caused unprecedented disruption to society, causing significant stress and anxiety in many people's lives. One of the concerns has been the impact of social isolation and disruption of services for people in recovery from substance use problems. Faced with these new situations, self-help groups and NGOs that work with people in recovery have had to adopt and find creative solutions. In this third webinar in our recovery series, we therefore want to highlight some of the positive learning outcomes from these times of COVID. Historically, recovery has been known within civil society, and as recovery-oriented organizations grow, so has the global voice of recovery, introducing recovery to the agenda even within the frame of global drug policy. So we're more than glad for this, and we can happily say that we have over 150 registrants today who are here for all of the afternoon, or all 2 hours of our afternoon, or morning or day, depending on where we are, to share experiences and positive outcomes of recovery interventions. Together with our partners, we welcome you to what I believe will be an interesting, positive, and fruitful webinar. So to make this process as smooth as possible, I will go through some practicalities before we begin. I will introduce each speaker prior to the starting time. We have 5 brilliant panelists today, so we have a lot to look forward to. Each speaker will have about 15 minutes to present, and after our third speaker, we would have a short 3 to 5 minute break to gather our thoughts, get some tea, and do some stretches. There are 2 ways to communicate with one another and with the panelists. There's the chat box and the Q&A function. You're welcome to use the chat box to present yourself, stating your organization and the country, and share any positive or less positive experiences that you have of recovery interventions during the pandemic. This particular webinar is focused on Europe, so please, if you're from other regions and countries, do share with us your experiences. There's also a Q&A option. It's on the lower end of your screen here. There you can ask questions or make comments directly to the panelists as well as myself. Cressida and I will keep track of these questions, and we'll have quite some time in the end of the session to answer Q&As. So we will keep them and answer them, or ask our panelists to answer them at the end. If you have any difficulties or if you have questions concerning how to get involved or anything, just write to myself or Cressida in the chat or send us an email. So on that note, I have the pleasure to be alongside all of you fantastic and knowledgeable panelists, partners, and participants today. COVID-19 times have truly showed us what a global community we can be. Something that our first speaker, Petra, knows quite a lot about. Petra de Bauer is from Narcotics Anonymous Sweden in the Public Relations Office. Petra has 17 years of recovery experience and voluntary work in NA Sweden and at international level. Thank you for being here with us today, Petra, and we are happy to have you as our first speaker. The floor is yours.
Thank you, Regina. Well, I will share my screen here with you. Give me a minute. Okay. Yes, thank you so much. As Regina said, my name is Petra. I'm a recovering addict from Sweden and a member of Narcotics Anonymous Public Relations. And I will talk about NA recovery during the pandemic COVID-19. Narcotics Anonymous, or NA, is a worldwide fellowship of recovering addicts whose primary purpose is to help addicts stop using drugs by utilizing a 12-step approach. The NA approach to recovery from drug addiction is completely non-professional, relying on peer support. NA members learn from one another how to live drug-free and recover from the effects of addiction. Membership is free, and we have no affiliation with any organizations outside of NA, including governments, religions, law enforcement groups, or medical and psychiatric associations. NA is self-supporting through member contributions and the sales of recovery literature. We are not an anti-drug organization, nor do we take any position concerning decriminalization or legalization. We are neither for nor against free needle and syringe exchange programs, drug replacement clinics, or other efforts to reduce drug-related harm. We will work with anyone to provide their clients with our services without interfering with their therapeutic regimen or client relationships. NA is composed of people who come from many cultures, age group, professions, and backgrounds. In Narcotics Anonymous, membership is open to all drug addicts, regardless of the particular drug or combination of drug used. Membership is based on a desire to stop using drugs, and including alcohol, and has a foundation, the principle of complete abstinence. It has been the experience of NA members that complete and continuous abstinence provides the best foundation for recovery and personal growth. Narcotics Anonymous is an ideal support network for clients who wish to pursue and maintain a drug-free outcome, no matter where in the world they live. What you see here, this is the 2019 map of Narcotics Anonymous worldwide meetings. We don't have the 2020 numbers yet, but I know that in Sweden we have gone from 400 meetings to 460 meetings a week this last year. And on the US virtual NA meeting page, you will find 2,500 plus virtual meetings every week. So there has been an increase of meetings this year. Addicts helping each other recover are the foundation of NA. Members meet regularly to talk about their experiences in recovery. More experienced members, known as sponsors, work individually with newer members. The core of the NA program is the 12 steps. These steps are a set of guidelines outlining a practical approach to recovery. By following these guidelines and working closely with other members, addicts learn to stop using drugs and face the challenges of daily living. Narcotics Anonymous is not a religious organization and does not mandate any particular belief system. It does teach basic spiritual principles such as honesty, open-mindedness, faith, willingness, and humility that may be applied in everyday life. The specific practical application of spiritual principles is determined by each individual. Recovery in NA is not a miracle cure that happens within a given period of time. It's a process, it's ongoing, and it's personal. Members make an individual decision to join and recover at their own pace. Our meetings are where we share recovery with one another, but applying our program consists of much more than simply attending NA meetings. Members share their successes and challenges in overcoming active addiction and living drug-free, productive lives through the application of the principles contained within our program. We are not concerned with the types or amounts of drugs used. We focus on the ways addiction and recovery affect our lives. NA meetings are not classes or group therapy sessions. We do not teach lessons or provide counseling. We simply share our personal experience with addiction and recovery. We celebrate clean time milestones, and newcomers are usually welcomed with a hug or handshake and a welcome key tag. There's no hugging now in NA, unfortunately. In the 2018 membership survey, this survey received the highest member participation to date. There were 28,000 responses worldwide and 2,200 from Europe. So regular attendance at NA meetings provides the opportunity to experience the NA message, and the European members attend an average of 2.25 meetings per week, and the European average length of clean time in NA is 8.86 years. In 2018, the two areas that received overwhelming improvement with NA attendance were family relationships, where 87% of our members stated enrichment, and social connectedness, realized by 88% of the respondents. NA literature states that active addiction is marked by increased isolation and destruction of relationships. Recovering NA has helped the survey respondents to repair the damage in their lives from drug addiction. Okay. When the COVID-19 pandemic broke out, members wondered what would happen to the 12-step meetings that they rely on, and they were afraid that isolation and the closing of NA meetings would cause a wave of relapses. This was stressful and unnerving times, and fear can be such a big trigger for addicts. But in many ways, the recovery community is better prepared for this moment than almost anyone. People in recovery also have a lot of practice channeling their fears and anger into service. NA groups and members did quickly switch from in-person meetings to digital meetings on platforms such as Zoom, Blue Jeans, and WhatsApp, allowing the group to continue to focus on NA's primary purpose, to carry our message of recovery to the addicts still suffering. Many of these meetings existed as physical meetings before, but now attract more participants, and they rapidly expanded. And some meetings are entirely new. Even prior to this pandemic, many NA members around the world, whether homebound, living in remote areas, in jails, or in institutions, have counted on participating in NA remotely through literature, phone calls with other members, correspondence by letter, email, or meetings online. I will just check the chat here to see that I'm not running up. In Sweden, we had one online meeting prior to the pandemic, and today we have 130. A total of 60 new meetings started 2020. We took virtual NA meetings into prisons and to parolees. In California, NA services reach 400 parolees every week through virtual presentations. In Sweden, we hold NA presentations for both medical and sociology students at the university. Social media has been a useful tool during the pandemic to make NA's message available. Knowing that so many people log into their accounts, post, or regularly check their feeds shows that NA can reach out to them. NA Sweden used Facebook and Instagram, and during 2020, the messages to these channels have increased. There's also a lot of informal groups with NA members on Facebook where members can share their daily recovery with each other. So that has also grown. Okay. With an online global network of groups available 24/7, it is convenient for recovering addicts to make 90 meetings in 90 days, as often recommended to newer members. Members share that they have doubled or tripled the recovery meeting attendance during the pandemic. It has also become possible for NA members to participate more regularly in special interest meetings, such as women's meetings, LGBTQ meetings, and meetings for members with disabilities. Like for me in my hometown in Gothenburg, we had 2 women's meetings a week, and today I can join a women's meeting every day of the week virtually. So and for people with disabilities, that's also a big change to be able to connect. Single parents and parents with small children can participate from home. They can go to more meetings than they usually do. Like if they have to get a babysitter, now they can just join when the baby's sleeping. Small NA groups in rural areas who have struggled to keep meetings alive are visited by members from other localities. NA meetings have generally seen much higher attendance after moving online than before. We have, like in Romania, we have this small NA group, and they were like 4 to 6 members before, and now when they have moved online, they have really increased their attendance, and they have meetings, I think 6 days a week now, and they are visited by members from all over the world. So there's that brings a lot of hope and experience and to that like small isolated community. So many groups encourage members to stay in the virtual meeting room after the meeting ends for small talk and coffee. So that's like one of the biggest things with the NA meetings. It's like this chat, like after the meetings and before the meetings, and they're connecting to with each other. So we're trying to like do our best to keep that. Clean time is still celebrated, and groups members are mailing out key tags and literature to those who need. Meeting online has been an adjustment, and it has its challenges. Tools have been developed by NA groups and service bodies to support NA groups to start virtual meetings, and the material can be downloaded from the na.org website. In some countries, there are groups who still meet face-to-face with a small group like of 8 or fewer. Those in attendance take precautions like keeping at least 6 feet apart, wearing masks, wiping down tablets in the meeting space, and not serving coffee. Or they hold hybrid meetings. It's like they partial virtual and still in the room. The move to virtual meetings could be a barrier for some members of low income or homeless communities if they don't own a tablet or a computer. However, as long as someone can find access to a phone with enough minutes available, they can attend a virtual meeting. What we all miss the most is this like human contact, the hugging and all the other touchy feeling aspects of NA recovery. That's like a big part of our recovery. And just like being in a room with 20, 30 recovering addicts, feeling that like energy and that special feeling, that's something we miss and very much. So, well, this brings me to the end of my presentation. So to summarize my main points, Narcotics Anonymous is a reliable community resource, even during the COVID-19 pandemic. Addicts find recovery through online meetings, social media, and digital presentations. NA members have shown great service commitment and ability to coordinate efforts to spread our message of recovery. Just feel free to contact us if you have any questions or if you want us to hold a presentation about NA for your organization. So thank you, big thank you to everyone for coming, and big thank you for inviting us.
Thank you, Petra. It's us who are giving the thanks to have you here today. It is truly impressive to hear how NA have adapted during these times of COVID to the participations online and accessing a broader range of groups and being able to attend specific groups almost 24/7 is just fantastic. And also you gave us the answer to something that we discussed quite a lot in how do we not lose this time for chatting with one another? How do we continue to have these little breaks together, and staying on after a meeting is a very good idea for that. So thank you for that as well. And I'll bring that with me in our future meetings here at WFAD. So thank you again, Petra. Thank you, Cressida. All right, so Our next speaker, his name is Phaedon Kaloterakis. He is the Assistant Director of KETHEA, which is one of the largest drug treatment organizations in Europe. He lectures at various universities in Greece and abroad, including the Aristotle University of Thessaloniki and the University of California. Phaedon is the president of CEROS, the prevention centers of the municipality of Thessaloniki, and serves in various international boards, including as the president of European Federation of Therapeutic Communities. Phaedon has been involved with the addiction field since 1980 and is very much sought after as a speaker worldwide. I myself have had the great pleasure of spending some time with you, Phaedon, at one such international conference in South Africa in 2019, where the conference reworked the schedule and ended early so that we could all watch the 2019 Rugby World Cup final.
The final, yes.
The final. So together with our South African colleagues, we watched this very historical moment when, at the lead of Siya Kolisi, South Africa's rugby team's first ever Black African president or captain, winning the World Cup. So as our colleagues ran circles of joy in the garden, we watched this recap of Nelson Mandela taking the field in 1995 after winning the World Cup. It's a day that I will never forget, and it's with this joyous memory in mind that I welcome you to the stage, Phaedon.
Oh, well, thank you, Regina. Thank you so much. It was really an incredible day, a day that I will always remember. By the way, your Greek has improved drastically.
I try. I'm trying my best.
It was not Greek to me, so okay. Actually, it was Greek to me. Thank you. Thank you for all you have done. But I would like to thank all the co-organizers for this and for giving me this opportunity. It's quite a privilege, but I would like especially to thank WFAD and Cressida for all the support. Thank you very much. I'm grateful. Now, the European Federation of Therapeutic Communities was established in 1981, and it has more than 70 organizations as its members from 27 different European countries, and it also has associate members from Israel, Lebanon, Iran, Colombia, US, and Japan. Don't ask me why, but that's how it is. Our programs, or our members' programs, have to do with prison-based therapeutic communities. Many programs are residential. Some of them are structured day programs. We have aftercare services, peer-led aftercare services, but also reintegration services in general. We do street work. And the Federation, the European Federation of Therapeutic Communities, encourages self-evaluation and also active participation in research studies. We believe that we need rigorous research so that we can also improve ourselves, but we can also show the people who make the decisions that this model, the TC model, the therapeutic community model, is quite effective. Now, the thoughts I will be sharing with you derive not only from the experience of my organization in Greece, from KETHEA, but also from other European Federation members, and also from around the globe, from around the world, because I represent my federation to the whole federation. And we have done similar webinars, not only in Europe, but also in Asia, in South America, etc. So I will not be very specific because I have the security of being followed by Monica and Lyndsey, and I know they're going to be much more specific and practical than me. Now, the new reality of this pandemic, this COVID-19 pandemic, brought a lot of fear to our staff and to our members. By members, I mean the people who receive the services. Some people call them guests, some people call them clients. We in Greece call them members because they're part of members, they're part of the community itself. And also it brought a lot of anxiety and grief. And along with this, there came very strict government protocols. For example, in order to accept someone in a residential unit here in Greece, we would have to have him or have her for 14 days in which is really against all TC idiosyncrasies. Petra mentioned a couple that are very similar between NA and also the TCs, that we need the physical proximity. After all, most of our work is done in groups, so you need the physical proximity. But also you need the physical contact. We are a tribe of huggers. We like to hug each other, to touch each other. And now this is not permitted anymore. So how do TCs, how do therapeutic communities react to all this? First of all, I think we should know that therapeutic communities are quite used in dealing with crisis. For example, when we had the HIV, but we know how to deal with crisis. We have the experience, and also that meant that we had to adjust and to adapt to this new reality. This in turn meant that we had to redefine and really re-establish core treatment priorities. So we were forced in a way to become more flexible and less static, which is a positive outcome. And I will mention 9 positive outcomes. I believe I will be on time. They're outcomes, but also lessons that have been learned because of the pandemic. First of all, we believe that definitions matter, words matter. So dealing with this pandemic also has a very specific mindset. So many communities do not talk about social distancing, for example, but they speak about physical distancing with social intimacy. So it's we have to define some terms, to use some terms and define some concepts in a different way. 2, because of a set of shared values that therapeutic communities have, we see more goodness and kindness from everyone involved. This to me is a very positive outcome, because in challenges like this, when we're challenged with a pandemic, human nature tends to go 2 ways. We can either become more mean and exclusive, or we can become more loving and kind. 3, members are taking more responsibility, and also members and staff are getting closer to each other. The decisions are being taken collectively more than in the past. There is more member-client input and less rigid professionalization, if I might say. 4, we're inventing new ways of coming together and also connecting with each other. A lot of our activities have to be done, of course, online. And of course, again, physical presence cannot be replaced. But this also brought an increased use of technology. There is always a difficulty with this, because you ask someone, from your PC, are you okay? And he or she says, yes, I'm okay, but you don't really know if he or she is okay. So there are many limitations to this. But also we discovered on a managerial basis that online meetings, now, and this is something that will stay, I think, can be done, so thus saving both money and time as well. Now, this new reality also pushes therapeutic communities out of the closet, so to speak. Many times, therapeutic communities are marginalized in many countries and undervalued. Not that much in Europe, but all over the world, this sometimes is the case. And now therapeutic communities are becoming more of an integral part of the continuum of care in any given national health system. So that's another positive outcome. 6, we have been forced to give again emphasis on services aimed to the most vulnerable among ourselves, in our midst, to the most vulnerable groups. Because usually when you have a pandemic or a crisis like this, you also have a recession, and the funding goes down the drain. And the most vulnerable groups are the ones who suffer the most. And I'm talking here about women, about minors, adolescents or children, about refugees, about people in prisons, or about people who are homeless and who are also addicted. 6, there is a way now to go forward considering or concerning reintegration, social reintegration. And we have to become more imaginative about this because this pandemic, as I said, brought recession and unemployment is getting higher and higher. So we have to become more imaginative, more creative in how we deal with this together, staff and members together, so that people will avoid relapse when they complete a program. Also, that's my number 8 point, we have become more environmentally aware. We realize that the pandemic has to do with the destruction of the environment. So we are teaching ourselves, we're teaching our staff, we're teaching our members, and I think in turn we can play an important role in the general community, teaching the community about environmental issues. And my 9th point, the last one, is that these are times that we need each other even more. So the development of efficient networks on a national, both on a national but also on an international level, should be a priority. Cooperation with others is a must. Usually, Regina knows this very well, I use some Greek words to be true to my heritage, to spice up my talk, to spice it up. And I'm going to use 2 words, and I'm going to finish with these 2 words. The one has to do with this 9th point, and it's the word, it's a Greek word, the word idiot. In Greek is idiotis, idiot. And I know in Italian, in other languages is as well, is the same as well in Spanish as well. So it's a Greek word, but the Greek word idiot doesn't mean stupid, that doesn't mean idiot. It means the private person. Even today, it's an ancient word, but even today it means private. So an idiot is the person who keeps private, who keeps to himself or to herself. So this is a positive outcome, I think, for therapeutic communities, because we realize we cannot afford to be idiots. We need each other more and more, and we have to reach out to others as well, outside the therapeutic community world as well. And my last word is another Greek word, and it is my mantra. People who know me are probably tired of hearing this word, because I always end my presentations with this word. But it makes sense to me, and it really made my professional life, my involvement in recovery more meaningful when I realized what it meant. And it's the word therapist, which is also a Greek word. Therapon, therapist, is a word that appears for the very first time in Homer, in Iliad, the Trojan War. If you remember, Greeks fighting the Trojans, the Trojan horse, Ulysses, Achilles and all this. A therapist was the servant of the warrior who helped the warrior put his armor on so that he could go and fight in the battle. So originally, the word therapist meant servant. And to me, this is a reminder, to me personally, but I think to all of us, that's all we are. Because the temptation is always there to play God, or a doctor, or to play doctor or nurse or someone, superior in a way. But this is a reminder that all we are servants, and what we do, we assist each other to put the armor on, because the people who are in recovery, that's their fight, and they're gonna give their own fight, and that's all we do. Nothing more, nothing less. So as I said, I believe that Monica and Lyndsey will be more specific or more practical with examples as well, knowing them. I'm saying this. But I think that out of this pandemic, this calamity, good things are coming out as well. And we have the chance to revisit our core beliefs in many ways, and also, most importantly, to reach out to other colleagues of ours and other people who are in recovery. So that's all for me. Thank you.
Thank you, Phaedon. And even though I've heard your words before, they always make sense and they go right to my heart. So thank you so much. And thank you for sharing these 9 very valuable points in terms of positive outcomes for the therapeutic communities. And it's something we can all learn from and take with us. I particularly enjoyed this environmental aspect. It's something that we hope to see the results of in a few years to come, that we have all become a bit more environmentally aware. So thank you. I will go on now to present our next speaker, who is very known to many of us here, including Phaedon, who referenced to Monica in his speech. Monica Barzanti has over 40 years of experience within treatment and recovery. She began at San Patrignano in 1979 as a volunteer, mentoring girls and young women in their path to recovery. From 1986 and onwards, Monica has been part of the community in a variety of ways, and is currently working within the international relations full-time, through which she coordinates workshops to the community by schools, volunteer groups, social workers, policy makers, scholars, and people working within the addiction field, both Italians and people abroad. Monica also collaborates in the creation and implementation of master courses on addiction and represents San Patrignano at UN events. Monica is a board member of many international networks as a consultant and expert in recovery and prevention methods, and she transfers experiences between people and organizations. So thank you, Monica, for being with us today, and you are welcome to take the stage.
Okay, thank you. Can you hear me? Now I will share my screen. First, I want to thank Phaedon, as always, so inspiring with his words about therapon. It's really true. We are servant and we have to provide armor, tools for our people to fight their battle outside. So now I'm sharing with you my screen. Here it is. Okay. Okay. No? This one, sorry. Okay. So now I'd like to share with those of you who don't know San Patrignano very well what we are talking about. We are talking about a therapeutic community, residential, drug-free, free of charge, and long-term. The program is a long-term program. So in our population, we have 3 different groups, which are the residents who are in recovery, between 1,100. They are allowed to go outside only for specific reasons, health reason, working reason, sport, but normally they stay within the community. The resident staff, which means the volunteer or educators that live within the community with their families, but they can go and come according to their needs. And also the employees that live outside the community and come and go every day. So we had to deal with these 3 different groups of people for tackling the pandemic situation. In Italy, in February, at the end of February, there was the outbreak of the pandemic of COVID-19. But we closed our community a couple of weeks before the national lockdown, because of course we were frightened at the beginning on the cases that this virus entered the community. So we closed everything. We no admission, no tours, no home and family visit. We prepared a quarantine housing, but we never used it actually, because in this first wave, we had no one case, nor the employees, no one had a case of COVID. So we were very lucky, we were very smart. I don't know for which reason, but everything went very smooth. Then in the second phase, of course, everything get better also all over Italy. And we had start again our activities in May, around May. So new admissions, new family visit and home visit, all of course under a strict protocol in order to avoid any contagion. And since September, we decided to distribute and make all our residents, also the people in recovery, use masks because we had people coming from outside, employees, and so we decided to protect everyone to avoid any case, and still no case in this second phase. Unfortunately, in the third phase, when a new wave of epidemic outbreak in Italy, we had cases of COVID-19 within the community, but without any important symptoms, I have to say. So we decided to have an extensive screening of all our people. We totally separated the different departments in order to avoid transmission between departments. We closed also our dining room for 4 weeks to avoid that in the moment when you were eating and you have to take off the mask, of course, it's an easy moment for the transmission. So all the protocols for accessing to quarantine areas were settled up, and we also identified and protected the most at risk among our people. What we are doing now is to coexist with the virus. We all still wear masks, all of us, all day wear masks. We, in our dining room, have a social distance as much as possible, so we eat far away from each other. And we try to continue our activities, most of our activities. What we can't do is to have tours or events, of course, within the community, because it is impossible to welcome hundreds of people. And furthermore, it is also forbidden at the national level. So no events, no gathering of people in number. This is the cases we had. 500 people get COVID. No one had any important symptom, a little increase of the temperature, but no one needed oxygen therapy, no one had pneumonia. I suppose that one of the main reasons is that no one smoked. All of us live in a countryside, as Phaedon said, so pollution is not here in this place. So I think that this could be important elements to understand in the future when our scientists will make studies about that, which are the reason why no one of us had any important symptoms. Then to go on, what we did at the beginning, of course, when someone gets sick with COVID, there was a bit of fear about this fact. But when they saw that everyone recovered without any complication, any major symptoms, they began to stay very serene and quiet. So we provide them with book, with television, with films, board games. They enjoyed this moment together in order to have more time for themselves, for knowing the friends. So it was something for them, a sort of holiday, let's say. They were very, very quiet, very, let's say, responsible and mature in facing this situation without really having any difficulty in facing it. So they also had the possibility to make individual sport in a dedicated area. So they, of course, when they were totally without symptoms, they were able to walk, to run, to do some sport in order to fit better. What was affected strongly by the COVID pandemic, of course, were the admission procedures, because we had to make all the interviews on platform via Skype or Zoom, and on one side this was an advantage, so we were able to meet also people from far away, and I'm sure that this will be made also in the future. So we learn how to make Skype interview and to be able to really understand what the other people is saying on the other side of the screen. The number of admission, of course, decreased a lot. In 2019, we welcome nearly 400 people. In 2020, 148. But a number is very good because those who abandoned the program were only 130. While in 2019 were 173. Please note that the people that abandon the program are not those in the first year, because we have a retention in treatment of more than 90 in the first year, but those normally the major abandon are between 18 months and 24 months. This is the moment in which a person feels really healthy and believes he is ready to go, he is ready to face his life, so he wants to leave, and of course, after a while, after trying to convince him he's not ready, we have to let him go. So what was good also, I've heard that many people, let's say outside the community, start using a lot of antidepressant, anti-anxiolytic. People get anxious because of this pandemic, but within San Patrignano, we continue to show a decrease in the psychotropic drug prescription that we normally use for those kind of trauma or mental issue that can derive from traumas such as sexual abuse or something like that. We sometimes for 20% of our people, we use also pharmacological therapy for a short period of time in order to help treating the trauma, the anxiety, the depression that can derive from this trauma they suffered in childhood. Another area in which we saw a lot of difficulties was the vocational training courses and social reintegration. Of course, the economic crisis outside was very hard, and so people in the moment of their reintegration find it very difficult to find a job, a placement, or to look for a job even. So we applied a policy trying to help and to take advantage of this situation. The courses were implemented all online, except for the practical activity that will be recovered in 2021, as you can see in this description. The red is the training hours that were not possible during 2020 and will be totally recovered next year. And actually the training activity were reduced by 25% and the job reintegration decreased by 30%. So it is a very high percentage of people that were unable to find a job. Actually, 1 out of 4 of our people reintegrate into the restaurant sector. And so these areas, all the restaurants, all the hotels were closed. And so they couldn't find a job. and we had to hold on a while. Actually, many of our people waited until the situation got better. And what we were able to do is to implement, sorry, let me show you this part that is regarding the social reintegration. We identify a project that was founded by the National Department for Youth for people between 18 and 29 years, but we applied it to all our people. And it was a project through which they could help it by a psychologist, help them to identify all their soft skills beyond the hard skill that we provided them through courses. So they were able to evaluate their transversal possibility to find a job also beyond the area in which they were trained. So this was a very good project, and we think to implement it also in the future to help them to make a complete overview, to discover better all their talents in order to gain also self-esteem, to be able to propose these skills in a job interview in a better way. So we will implement this orientation to job also in the future. Other positive outcome, online video calls with their families. This is a good thing, and I think we will implement this also in other cases in which families can travel to San Patrignano to visit their loved one. And so this is a possibility that will allow us to make more connection with their parents. Many people access to library and read book, and a lot of more people practice sport. We also learn how to apply remote work for employees, and I think this will be applied also in the future when it is possible. Telepsychiatrist also was very useful, so our people had their meeting with the psychologists or psychiatrists online. And at last we created our online shop. We have been trying to do it for many years, but this COVID triggered at last this opportunity, and we created this online shop. Another important thing we did is to transform into online programs our prevention intervention. We used to meet 50,000 students every year. Of course, the number decreased, but we were able to meet 24,000 students from March to December, all of them online, with programs online. So in this moment in which students and young people are very shocked by the COVID situation, are isolated from their friends, from their peers, it was important to reach them out through online program. What else? We had the possibility, we had funds to equip more areas for courses and distant learning and professional course. So we obtained more Skype room and computer for our people. We increased also the possibility of having important teacher for our courses. And so I think that not everything was bad about this COVID, but many things that will remain and last and will improve our flexibility, our capacity of helping our people. What else? Great, as I said, we discover greater flexibility and adaptability, not only in our people, but also in the staff. As Phaedon said, the connection between staff and resident became closer, and we were able to take decision always with a lot more maturity, responsibility, and really facing the situation as it was, but also with an optimistic view for the future. So I think that the overall fruit of this situation was mainly positive rather than negative. Now I want to conclude with our CHIME framework. All of us know what CHIME is. Our friend Dr. David Best mutuated it from the mental health literature. CHIME means connectedness, hope, identity, meaning, and empowerment. It's all the elements that are important for a good recovery process. And I think that they also were important for our people to face the COVID pandemic in a good way, with a good attitude, with a positive attitude. Let me suggest that our world, our global, the humanity would take a lot of advantage if they use this element to recovery from the crisis, from the anxiety that the COVID pandemic has brought to them. So this is my optimistic view. Let's hope that we will get better in the future and learn to be more connected, more solidar with other people, to have more hope, and not to say that the desperation will lead us to bad choices always. So thank you for everything again.
Thank you, Monica, for sharing your positive learning outcomes from San Patrignano, showing both the positive and the less positive outcomes and how you handle these within your community. And based on your presentation, it seems that it was both luck, but mainly intelligence that had you get through this pandemic in such a good manner. And it's really lovely to see that some of these triggers in adopting to a new virtual world has made some improvements for you that will last in terms of interviews and your online shop. So thank you again, Monica. And it has come to that time now for a short break before we go on for our two next speakers and our questions and answer section. So we will put up a little picture and then we will gather back here in about 5 minutes. So 5 minutes past, we'll restart. Hi, everyone. A few minutes goes by very quickly. I will start now by introducing our next speaker, and I hope that for those of you who went to get some tea or water or stretch will hear my voice perhaps and come back. I have now the very great pleasure to introduce our next speaker, Lyndsey Wilson-Hague. Lyndsey is the head of operations for Phoenix Futures Scotland, a position that she's held for the past 6 years. Lyndsey has worked to support and develop innovative service provision for individuals as well as families experiencing issues with drugs and/or alcohol across residential communities and criminal justice settings. Lyndsey joined the Phoenix Futures in 2007 after working in offender rehabilitation and forensic psychology services in the National Probation Service and HM Prison Service. Since 2007, she's directly led and implemented a range of services, including community-based treatment and recovery models and psychosocial services, including therapeutic communities based in HM prisons in the north of England. As an advocate for therapeutic communities, Lyndsey has spoken at various international conferences and is a national TC trainer and has been a lead reviewer of the European TCs. So welcome, Lyndsey. We are thrilled to have you with us today, and the floor is yours.
Thank you very much. I'm just going to share my screen. Just bear with me. Okay, so can you see the presentation okay? Yeah, okay, I'll start then. Firstly, thank you for inviting me to speak today. For all of the partners involved and through the EFTC as well. I'm here to speak and give a perspective from a Phoenix Futures perspective. I'm current head of operations for Phoenix Futures Scotland, so there may be a lot of reference to Scotland in here as well as England. Okay. So Phoenix Futures delivers a range of modern community, criminal justice, residential rehab, and housing treatment and recovery based services. And that's based on best practice guidance, a sound evidence base, clinical guidelines, so the UK Orange Book, and we have over 50 years of history. These photos here on the presentation are from our Glasgow-based therapeutic community. We moved from an old building into our new accessible home in 2018, and the relocation meant that we can now support people with a wider range of needs, including people with mobility issues and wheelchair users. This year, we've worked effectively and efficiently to ensure we fully comply with restrictions due to COVID-19. This means added measures to ensure the environment is COVID safe, for example, PPE and staff wearing masks, infection control measures and cleaning regimes, client admission quarantine procedures, daily staff screening in relation to temperature, and testing for all staff now 3 times per week. We have all recently had the vaccine as well as part of the UK-wide rollout. We have shared our practice with other rehab providers in Scotland so we can all remain open and safely support clients who require our services. We're happy to say our residential services have remained COVID-free during this time, so hopefully the measures that we have in place are working. We're happy to share our details of our COVID-19 measures documents, so if anyone would like this document sent out, please just shout and I can send that over. With this impact and additional measures, we've still seen a positive completion and move on rate at 89% and have maintained positive move on from our residential services into our recovery housing services for ongoing support. Although with everything going on, we have seen more referrals for people experiencing emotional and mental health needs. And some of our adaptations, which I'll discuss shortly, have assisted in the support to both physical and mental health. These are some of the highlighted positive adaptations we've made. So even before the government restrictions came into effect, We took steps to ensure community involvement within our residential rehab services by engaging with the community to implement their own guidance. The community set themselves various rules, which included no hugging, keeping a social distance, increased cleaning regimes, a reduction of group sizes, and no non-essential visits, and that sadly had to include families. As rules and solutions came from the community, there was that essential buy-in from the start, and it prepared the community well for the government measures which we had to put in place, which came a little later. The service progressed during lockdown to be perceived as a safe haven, a place that was open and accepting people when they needed support the most. We feel we've embraced the therapeutic community as method approach now more than ever. There is now much more community-led initiatives, such as community-led seminars, and the senior residents have shown incredible resilience and support to staff and residents by motivating and challenging others. They've embraced the adaptations we needed to make, being role models within the community. They now support with the development of weekly timetables. I'm just hoping that maybe through this difficult time, we've learned that through adapting, we can actually grow as a community to be stronger than ever. We've ensured connectivity with family and friends through video and voice calls. At times when restrictions were eased in the UK, we did restart family visits across all of the Phoenix residential services, and they often took place in a gazebo marquee outside in the garden, and had robust measures in place to ensure the safety of the community, but also families as well. We've increased health and wellbeing initiatives, such as our recovery through nature and recovery through the arts programmes, and they're now more prominent in programmes than ever. We are now growing our own vegetables in all of our residential services and have continued our outdoor programmes, implementing sustainability strategies such as carbon capture gardens. We have increased creative and wellbeing interventions with increased focus on things like yoga and meditation. The residents are teaching each other how to play guitar and different instruments, writing songs and keeping one another entertained with performances. The creative intervention groups are proving really popular. Our partner agencies and graduates have also been supporting by delivering interventions online that we can stream directly into the service, such as keeping fit, creative writing, mindfulness, relaxation, and gender-specific support. For all families and individuals accessing any of our community services in Scotland, we've ensured that we've conducted doorstep welfare checks to ensure people are okay. At times, this has meant providing data cards to ensure online connectivity, providing emergency food supplies, and encouraging others to seek medical advice. This was when they were fearful of going to see a doctor or going to a hospital due to COVID risks. We have also successfully designed and implemented the Phoenix Online Social Club, and that happened within 36 hours of the initial lockdown back in March. The Social Club provides a weekly timetable focusing on social connectivity, but also health, wellbeing and support interventions across video calls and social media channels. Following this, we then launched our own Recovery TV, which can be accessed on Facebook and YouTube. This contains motivational and knowledge-based segments such as equine therapy, cooking classes, good news stories and service tours. Throughout 2020, we have surveyed staff and community members in our residential services on COVID-19. Here are some of the positive learning outcomes from the most recent survey. TCs acting as safe havens for service users during the pandemic. A service user quoted, "I think it's a scary time for everyone, so having somewhere warm, safe, and to be a part of a community will be better for someone's mental health and physical well-being." Another point was creativity and alternative ways of thinking and approaching daily tasks in the TC. A staff member said, "We become more creative with groups, trying to add a fun aspect to them. We also try to be creative with coming up with new privileges when achieving phase moves." One of the other points was support amongst staff and the appreciation of the hard work during the pandemic. There's a number of quotes here, such as management have gone above and beyond to support staff, and we're all very supportive as a team with each other, and we've made best of the situation. We're also finding that people in treatment are now becoming a lot more aware of the world in which they live. So here's some of the wider positive outcomes. Recovery and Residential Sector Group was established in March last year, which is a range of residential rehab providers in Scotland coming together to work collaboratively on a common purpose. And that is in order to promote that access to residential treatment should be open to everyone who needs it as part of a wide range of treatment options. We've also assisted in the development of rehab protocols in response to COVID-19 and have supported other organisations to remain open during this time. The residential sector coming together has also been able to source funds from the Drugs Task Force to pilot rapid access to residential rehab with continuum of care models following a near fatal overdose. The Drug Death Task Force was set up by Scottish Government to address the rising numbers of drug-related deaths in Scotland. Their primary role is to coordinate and drive action to improve health outcomes and reduce harms. Due to COVID-19, a programme for early releases from prison was introduced. Following this announcement last summer, we were able to secure funding directly from Scottish Government for a national prison to rehab pathway, where upon release, people can move directly into residential treatment and benefit from the range of support options available from a rehab intervention in order to increase recovery capital. I'd just like to finish on a service user quote here from the Wirral, our Wirral residential therapeutic community. I will let you read that. And then that's the last slide. So thank you so much for listening. Thank you for having me. If you do want any more details or to discuss anything further, my email address is there and I'm happy to be contacted directly. Thank you.
Thank you so much, Lyndsey. It's fantastic to see that you've had such large impact throughout the year and secure your funding and enhancing recovery capital and enshrining measures to make sure that you're COVID safe and able to be open. And it's great also to, again, within your presentation, see this community and how community-led initiatives is sort of something that we see in all of our positive outcome experiences of the speakers we've had. Especially in these times of isolation, it's great to see that you're working on increasing health and well-being and developing these community developments and led initiatives. So thank you again for being here with us, Lyndsey. Our next and final speaker before moving on to our Q&A, who also has been active in planning this webinar and is somebody who has truly set the tone for the voice of recovery within the Western Balkans and, dare I say, also on the global agenda, and that is Boro Goic. Boro, after having successfully completing rehabilitation, Boro has been actively involved in the recovery field since 2006. He established the NGO Celebrate Recovery with the aim to help individuals and families recover from drug addiction, and is active in grassroots activities in Bosnia and Herzegovina and the Western Balkan countries. In 2013, Boro became chair of the Recovered Users Network, RUN, a unique European platform which represents the voices and rights of people in recovery. Furthermore, Boro has been part of a global drug policy debate as the representative of recovered users and advocates for balanced and recovery-oriented drug policies on national, European, and UN level. So we couldn't think of anyone better to finish us off now today before the Q&A session. Warm welcome to Boro. The floor is yours.
Thank you, Regina. Thanks to all previous speakers and also thanks for all participants who invested these 2 hours of time, to listen a little bit about positive outcomes in recovery. So I would like to share the screen. Yeah. So basically, I would like to speak a little about community-based recovery interventions here in Sarajevo and in Bosnia and Herzegovina. During this pandemic, of course, I think one of the biggest challenges in this really time, which we didn't expect at all. Who could expect in the beginning of 2020 that we will live such a way, that we will organize webinars, that we will not be able to attend the conferences and to have a chat, that we won't be able to travel, etc., or to be able to visit the restaurants, bars in different countries. So I think the biggest challenge in this everything will be to research inside of our services and to see really what's changed, and to really see what impact all the COVID pandemic and all the measures brought into our services, and how should we act in the future. I think this is one of the biggest challenges, because we see, for example, what in the May and what all information about COVID we had in the May, the difference was in September or October. So it's a totally challenging time of having some wisdom how to work even in this recovery field. So I will try in these 15 minutes just to be a little bit specific about what we are doing in Sarajevo, Bosnia and Herzegovina, and about some data that we analyzed and thought, okay, that can be combined with our future services, how we will develop our future services, and that's what happened during the COVID period. Just to say a little bit about us, we are an organization based in Sarajevo, Bosnia and Herzegovina, but through our partners in Belgrade, Serbia, and in Nikšić, Montenegro, basically we are working in almost similar program, and basically are covering area of 3 countries which are non-EU countries, countries which with a high rate of corruption, countries with 11 million citizens, and countries where system of drug demand reduction is not so developed. But I would say countries where you could see a lot of people that are in recovery. About us and about celebrating recovery in Sarajevo, I would say that everything what we are doing, not to mention that all activities, everything what we are doing, we are trying to establish, to create or to maintain recovery-oriented systems of care. That means if we are going to work on the multi-sectorial way, if we are going to work with the public institutions, then we want really to work on the recovery direction. We want to really see that the people achieve their maximum potential. We want to see more people integrate into society and less people being stigmatized because their addiction. So basically what we are doing are early interventions, then resocialization and treatment mediation. So we are not residential rehab center, we are doing community-based treatment. And what I want to speak today, mostly it's some analysis of our counseling center, where we are providing unique, free and anonymous helpline, which is the same in Bosnia and Herzegovina, in Serbia and in Montenegro. And we have only anonymous helpline for the drug addiction problems. We are having self-help groups for resocialization and for women, and also we are running a multidimensional family therapies and also one-on-one counseling. So basically, if I look through this pandemic period in our data, I would like to see, we saw the clients, 2019 we had 40 people who asked for help in our organization. And in 2020, we have 46. It's a 40% more. It's a significant increase of people who ask for help. And from the other side, we see, for example, family members who are sometimes more than, we see that it's 121 in 2019, and now only 86. And when we analyze a little bit why family members are not asking for help, or not wanting to join in some different groups, then for sure this pandemic period was not the time where a lot of crisis being happening inside of some homes. Let's think on this way. We had a lot of cases when families being calling us and coming to have some services, some counseling, when something really disastrous happened in their homes. What that mean, you know? So somebody needs to be arrested or something needs to be a trigger that they are calling us and wanting something from us, some kind of services. I'm thinking during this pandemic period, you know, everything been lowered down. Even this crisis situation been not so exploding inside of different families. So this is some kind of understanding why that happened. If we look, sorry. Okay, if we look of our services, we see that everything remained almost the same. One-on-one, with same self-help groups, same number of services, family meeting, almost same number of services, and then phone calls. So we thought pandemic outbreak, now it will be maybe some recovery outbreak. A lot of people will be on the edge, will not know what to do. Everybody will call us. We had such an expectation, but it didn't happen. So still, we cannot say that the pandemic brought more people. I'm speaking about our organization and about Sarajevo and Bosnia-Herzegovina, that pandemic didn't brought more people to ask for help and want some kind of services from us. But when we see online meetings, we see that we never held any kind of online meetings. And now in this year, we hold it more than 250, what is significant a way how to think for the future if this continues, if this thing continues in the future. Okay, just a short overview, who's been calling us during the pandemic and who's been on our services. 27% of people who are using amphetamines, 4/5, so 80% of all people who are coming to our organization want to enter recovery process. So people are in need, who are coming, they want to do something in their recovery process. Dropout rates in this pandemic period, 30%. So, but in 2019-21, also it's not a big change. We cannot say that pandemic now did something for the people in recovery who are coming to our organization that they said, I don't have a motivation because of pandemic. I will explain maybe a little bit more later about that. Only 9 mediations to different institutions. We cannot do all treatment work alone, and I don't think that anybody could. We need support from the different institutions. We are somebody who is sending sometimes people to a detox department. We are sending to a social affair offices. We are sending to a different NGOs where we see when we see that we cannot provide some services. And now, during this pandemic period, only 9, never been less. So multi-sectorial work was almost invisible. And one thing that was amazing, unbelievable, that was 0% were sent to rehab or therapeutic community. When we see that somebody cannot be treated in community, that recidivism is always repeating and repeating, we are always telling people to go to some safe environment, so to some safe place, which is some long-term treatment, etc. But now it's 0% that we could send to rehab. First, there was no willingness. So people being afraid, like, this is uncertain time. I don't want to commit myself to go somewhere and to spend there some long-term treatment. And it was very difficult mission, as we heard also from some Patrignano. So it was, you need PCR, you need to be somewhere in isolation for 2 weeks. And the addiction problem, it's enough. You know, so you are speaking and trying to motivate somebody, and then we have again some obstacles in the going into the rehab centers. So it was 0. And we need to rethink what to do, and we hope that all the rehab centers and other institutions will increase their standards in the way, again, to approach people on a little bit different ways. Okay, let's see for some outcomes during pandemic. Monica said about connectedness, about hope, about meaningfulness, about identity changing, and she said about empowerment and maintaining sense of connectedness among service users. It was something that was very visible. This is so important. People could still, during the pandemic, feel that connectedness. And this is something what brings inside of people who are in recovery some strength. I'm connected with someone. I could share something. They accept me. Doesn't matter if it's that online or if it's that live in person. I feel support in my recovery path. So that connectedness, I think it was very, very important that we could provide, and we saw inside of people that they are accepting that. Even during the pandemic, when everybody felt a little bit isolated. Or, for example, some other outcome in our organization was we had, for example, support group for women 2 times a month. Then they showed a need that they want to meet online once a week. And this is really something amazing. People are showing more needs during the pandemic to share, to be accepted from others, and to speak about what is happening in their life. Not many things is happening around them, but maybe because isolation, a lot of things are happening inside of us. So self-help groups was for a woman once a week. And for example, more time for sharing and useful links and literature. Who had more time to read something than now? So we are living in a stressful world, and we need to have that activity and that activity. And now maybe came a time when we offered some useful links, read it at home. There is nothing else to do. Read some literature. It can help you in your recovery path. Then also, for example, we saw that people who started a program before pandemic and their recovery path showed a greater motivation than those people who started recovery during the pandemic. And also this support and online support proven successful in creating individual recovery plans. That was a very positive outcome. Let's say that online you can speak with the people and you can, let's say, communicate in the way what is the next step, what they need to do. And more involvement among service users from rural areas. So before we've been telling to people who are 200-300 kilometers far away from us, living in some smaller places in Bosnia and Herzegovina, to come to have some counseling meeting, to have some motivational meetings. And that was not possible sometimes. Now everybody was equal. It was the same approach for everybody. And some people really accept that, and so that is a good thing. But challenges are also there. For example, young people aged less than 20 found it very hard to adjust and to retain in the online interventions. So younger people, less motivation, and they dropped off very much more from the program. Lack of motivation was a significant factor for many who drop off the program. And also this hopelessness that we recognize in society influence service users negatively, that they are sometimes dropping off from this. So it is very hard in this period, even with the people who are not our service users, with your friends, you know, to have some meaningful plans and to have some hope that we will do this, what we are planning. So this time of pandemic and social isolation, I think, brought one hopelessness into society where we cannot plan properly, and that's a problem about motivation to the service users and clients who are coming to us. In the future, if you are investing in your recovery, can bring something back. Also, it was a challenge for the people for the online interventions working from home. So not everybody can be from 8 o'clock in the morning working until 4 o'clock afternoon online, and then you suggest him to be again for one-on-one meeting at 6 o'clock. Everybody is sick about online interventions, online work from home. Then also sometimes people do not have a proper smartphones. And what's then with them? You cannot ask people to come to when it was pandemic time, and then internet connection sometimes broke. So you want to express what's happening, feelings, what's happening with you, and then connection break. This is something what is challenging, of course. I said already, multidisciplinary approach has not been visible. Something happened. Everybody spoke about standards that your organization brought. And there are many organizations and institutions start to think about how to organize and standardize ourselves to keep us negative from COVID. Okay, and that's proper thing. Everybody needs to do that. But what happened with that many people couldn't approach that institution. And many people was not on the workplace. We've been calling different institutions, nobody's there. Everybody's keeping some kind of standards, and we cannot ask a question if he can go to detox or this or that. I'm not telling about closure or methadone treatment centers being giving a methadone and then every 2 weeks you need only to come. That means no connections, no possibility to influence somebody eventually to rethink what to do in his program, etc. And of course, somebody said employment, I think Phaedon, employment and self-sustainability of people in recovery has been put on hold. So it was no talk about employment where nobody is employed nowhere. So everything is closed, bars, restaurants, tourism is almost dead. So how to encourage somebody to search or seek for a job? Maybe in the future we should everybody think about some kind of social entrepreneurship where people will work together, because who knows what the labor market will bring in the future. But let's hear some clients' voices. We asked few people, what do you think during this pandemic about your recovery path? So I feel like I'm in an aquarium, isolated, and can't wait to meet in our library again. I feel overwhelmed with multitasking at home and really need some me time with our support group in person. Other person said, regardless of the pandemic, I have never felt better. I think that the pandemic could be used as an excuse, but I miss our recovery group and meeting in person. Really, Zoom cannot substitute that. And third person said, I'm really grateful for this online support group because I'm from a rural area, and if it wasn't for this, I could not participate. This online group connected me with others that I can relate and talk to, and it makes all the difference for me. Nice voices. Conclusions that we have. Let's say we had some brainstorming and now came in our organization with this. Maybe somebody can see the parallels with his work. Recovery from addiction continues in new forms despite negative external circumstances. So I'm sure in this thing, it can be a war, it can be a poverty, it can be a new pandemic or new viruses. Recovery will continue and people will do recover. Online interventions are proving to be a good, but no means that are only tool in the age of social distancing. So we can replace eventually our meetings one-on-one, but online interventions can not be the only tool. We need to think for the future how we will develop different things that can help people to recover. Maintaining contact was really something that helped people with difficulties. And when service use needs support and help, they focus less on methods of service provision and more of actually receiving the help they need. This is something what we know for people in recovery. That is, if you have a need to change yourself, because you've been using drugs for so long, those needs will not say, I don't want to participate in the online intervention, I want only alive. Those needs will bring you to a place where you will accept different services and try to develop yourself and to get off from the drugs and to achieve your maximum potential. And also several successful testimonies have shown that the people do progress in the recovery process. For the end, Phaedon is maybe repeating always the same, and I'm always trying to find some new, I don't want to say wisdom, but some title. And I think the challenge for all of us and the challenge for the future for us who are service providers would be that we as a service providers and society should protect ourselves, but our protection should never go before the needs of people and families suffering from drug addiction problem. So thank you for your attention, and thank you for organizing this webinar.
Thank you, Boro. We have the pleasure of working closely together with you and following the progress of your project. And I'm always impressed and intrigued in hearing you and your other project partners speak about the work that you do. There were some surprising challenges, seeing that young people were less involved in virtual events. I would have assumed otherwise, but it's good to see as well that you are meeting these challenges with motivation and using the CHIME model. So thank you, Boro. And we have now arrived at our Q&A session. So for those of you who have questions, please do write them either in the chat or in the Q&A box. Before I ask the first question here from Lena, I just wanted to share one of the positive experiences from the chat, and it's from Margaret K. Julius from the Eye Opener Foundation in Nigeria. She says that one of the positive experiences in this period was providing palliatives for about 150 vulnerable women in Shukun local government in Kaduna State, women that have children who have challenges with SUD. So thank you very much, Margaret, for sharing this. It's a very, very positive outcome to hear about. So for our first question, we have a question for Boro from Lena Harake at WFAD Sweden. She asks you, Boro, what did contribute to that women are increasing their attendance in your meetings? So what was the activity or something that made the attendance of women higher in your meetings?
Let's say we had before start of the pandemic group of women who are supporting their husbands or sons or familiars in the recovery. And what happened during the pandemic, that many excuses that they brought before, like I need to work until 5, I cannot come, and nothing will change, you know, they've been more concentrated on their son's lives, son or daughter's lives, or their lives. And I think during the pandemic, they start to be concentrated a little bit about their needs and what they need. Because I think that pandemic and isolation and has something together with how people in addiction feel too. Suddenly we could not see our family members, or suddenly even if somebody wants to help you, they've been on distance from you. This isolation can be said it's sometimes equal, not 100%, but we can say that is sometimes this isolation equal with a feeling what people in addiction feel. They are sometimes a lot isolated. And I think the women felt the same and then wanted to participate more on the self-help groups. And of course, you know, as longer you are in the self-help group, you are giving more, and then you are not only somebody who is taking from the group, you are giving. And that sense of giving during the pandemic is very important, that we need to give something. Because we are close. Whenever I want to give something, it's some barrier, it's some obstacle. And on that group, people with sharing their experience and what they feel could give something. And I think this is one of the reasons.
Thank you very much, Boro. We have a second question here, and it's for all of you. It's from Vesna Rejcevic. I hope I pronounce your name correctly. Vesna asks, in general, how do your organizations connect with other specific organizations that educate people at some healing and medical methods? Vesna says that all around the world, there are a lot of different healing and helpful methods schools. Does anyone like to go first in this one?
I can say something about that. I would say that for us in NA, we cooperate with a lot of different, both like treatment centers and hospitals and prisons, and to provide like what you call it, as like a complement to their treatment, and because we have like NA and the 12-step and the NA meeting and the 12-step program works well with together with the, it doesn't stand in conflict with any other treatment. So it provides like a great supporting network, and you can attend the meetings 24/7. So even if you're in treatment, you can go to any meetings after the treatment is over, or you can combine your treatment with the 12 steps meetings. So for us, we do a lot of that kind of cooperation. And a lot of people, a lot of treatment centers, or like organizations like Boro's organization use NA and the 12 steps meetings for their clients or members. So they have a broader supportive network. And that's also the same with the women's meetings, because we have also seen like an increase in the women's meetings. As I said before, we had one meeting here in my hometown, and in Sweden today there are 6 NA women's meetings every week, so you can join an NA meeting every night. And I think it's a lot about like it's important with that, like Boris said also, that intimacy, and you need to share and get close to people and share your experience and your fears and your feelings with others, and you need to do that in a safe space. And I think the women's meeting for women are that create that safe space, like where you can share freely about what's going on in your recovery. So we have seen an increase in that as well. So thank you.
Wonderful. Thank you.
Regina, I'm not sure I understand the question. I'm not sure I understand the question.
Right. So the question is, in general, how your organizations are connected with other specific organizations that educate people in healing and medical methods. So if you sort of perhaps cooperate, or if you somehow, work together with such organizations that offer healing or medical methods. Is that?
I can say something regarding this. For example, San Patrignano welcome people that comes to San Patrignano through the public service for drug addicts, which are normally medical managed. They give methadone, they give other kind of medication, and then if they want to quit everything and go to therapeutic community, they escalate methadone and enter in some therapeutic community, and San Patrignano is one of these community where methadone is not given. Actually, in Italy, there are also therapeutic community. I don't know if it is appropriate to call them therapeutic community, but are places where people take methadone in maintenance, and so they collaborate with, of course, medical institution to obtain this kind of drugs. I think, but it is not related to this situation specifically to COVID-19. It is in general, the question.
Yes, I believe you answered it. Thank you, Monica. And I know Phaedon wanted to say something as well. So
I would like to give it a try, at least. If I understood the question well, for example, the organization that I represent, the European Federation of Therapeutic Communities, promotes one specific method, the therapeutic community. But I think one of the lessons that we are learning because of the pandemic is that there is an immediate and urgent need for openness, for inclusivity, even for unity. We cannot afford, as I said, to be idiots. So although, as Boro mentioned, there are many difficulties in collaboration with others because of our preconceptions, because of our methodology, because we think that we hold the truth, we still have to work together for the benefit of the people we serve. Remember, we are servants. So I think one way to do it is by joining existing networks or fora like the Vienna NGOC, for example, or by creating some networks. Now it is more urgent than any other time, I think, in recent history.
I can come in as well and just explain that all of our Phoenix services all work in partnership with a wide range of different organisations, because we need to tailor our approach to everyone's individual need. So that may mean housing for some person, it may mean trauma-informed practice and engagement with mental health services and psychology in another. But in relation to the medical model as well, we do detox in our therapeutic communities for that first 6 weeks. So we are engaged with medical professionals at that point.
Thank you, Lyndsey. I'll share here another positive experience before moving on to the next question, and it's from Crispin at Child Space Organization. And they had numerous positive things during the pandemic from March 2020. You can see here in the chat box, he's linked to a very fantastic video showing how they were able to accomplish many advocacy activities online, including advocating against ADA by young people themselves. So please have a look at that in the chat box. Our next question is from Lucia at Dianova International. She says that, as some of the panelists highlighted, COVID has also put a lot of pressure on staff members on how to quickly adapt to new contexts, fear of COVID in work environments, huge challenge for human resources, coordination when professionals may be in quarantine, etc. She believes that COVID has also evidenced the need to take good care of our professionals. Her question is, how did your organizations face these challenges? She's asking also if you have any good practices that you could share with us.
We have, sorry, I was just going to jump in there, apologies. We have tried to protect staff as much as possible by keeping communication channels open throughout the pandemic. We also launched health and wellbeing calendar as well, with various online events, which take your mind away from work somewhat, looking at focusing on staff health and wellbeing. So we put some quite integral structured elements in place to protect staff and ensure that if they do have any questions, with even as simple as dedicated COVID email inboxes to raise questions or concerns. We also have a COVID-19 organisational task force as well that meet every week. So everything is discussed on a weekly basis and then disseminated through Phoenix News to all of the staff, but also encouraging, especially in our therapeutic communities, encouraging staff to take annual leave as well, because quite a lot of annual leave has been cancelled, especially in the early days, and it's well-being is so important. That time away from work is so important, so we don't see burnout. So there's quite a range of things and topics that we look at.
Thank you, Lyndsey.
Can I just follow?
Of course.
Yeah, I mean, as Kethia here in Greece, we do exactly the same things that Lyndsey just described. But now, as a European Federation, because we are a network, all we do is we encourage all our members to talk with each other, and we try to provide also the room for this, the space for this, so to exchange experiences, know-how, and also how we feel. So that's all we can do as a network.
Thank you. If anybody else wants to share, please go ahead. If not, I'll move on to the next question. All right, so we have a question here from Lena Harake again, asking how the authorities supported your work. We then have 2 more questions. We'll see how we go. But for those of you who haven't received answers for your questions, by the time we finish, we'll ask all our panelists to write an answer and we'll send them out after the session. So again, how has the authority supported your work?
The UK and Scottish governments have been very supportive for us as a whole, really, in distribution and access to PPE equipment in the early stages. Also, their support to get staff on testing regimes. So now we test 3 times per week, and that's the proper formal test, but also 2 LFT tests per week, the quick access. I think in general terms, especially when it comes to funding, it's a difficult subject to discuss in very short space of time in the UK, especially in relation to residential treatment. But there's announcements going on right now as I speak from Scottish Government, and I think they're going to announce further funding into addictions and drug alcohol treatment. So I'm waiting to find out and see Scottish Parliament for more funding to come into the sector as a whole, really.
If I can add, I see on the attendees that all representatives from the different office for drugs or ministries in Croatia, in Serbia, in Montenegro, and in Bosnia and Herzegovina are presented. So that shows that they want to follow what we are working even on this kind of webinars. And for example, the project that we are doing in the Serbia, Montenegro, and Bosnia and Herzegovina, we had organized one multidisciplinary group where we are communicating and really reporting. Even we don't need to report them. They are not giving us money. So we don't need to report them, but we want to involve them in the work, what we are doing, and to see some kind of support, which we are giving when we need to organize something, when we need to have a communication with some other institutions where we cannot come as an NGO. They are helping us so much they can. So this is how I see that help from the authorities, which is for us now enough, not to speak about some millions that they are need to give us. So this aside, we are putting that aside for now.
If I might say something, in Italy, the first wave of epidemic was so all of a sudden that the problematic groups, vulnerable groups, were mainly the elder. And I have to say that our government was too busy in addressing all these issues, and the problem of people with drug use problems were left aside, and nothing was done to support the communities and the services in the initial phase. Then later, a little bit more ID protection were provided, and now we have a good collaboration with the sanitary service at a local level that provide us with the swabs and everything is needed to welcome new admission and to test people when necessary. So now the mechanism has improved, but in the first wave during spring until May, we were totally isolated, and we have to count on ourselves. Not only San Patrignano, but all the community were really a bit angry about the government because they didn't do nothing at all.
Thank you. Go ahead, Phaedon.
Yeah, I can only speak about the Greek experience. So it's not about the European experience, but the Greek experience. We were among the first ones to be tested, both members, clients, and staff. And we are also among the first to be vaccinated. And also the government provides us with these special suits that we wear when we go in prison, in our TCs in prison, in our therapeutic communities in prison.
Thank you very much. And unfortunately, with 2 minutes to go, I will round off here. We have a few more questions in the question and answer option here. And for you panelists that can see that, if you're able to, while I close off, maybe type the answer, and then we'll keep all of the questions that you've asked and send you out some answers after this session as well. I want to make sure to finish by the mark with 1 minute to go. So I will try to wrap up the session as quickly as possible. It's been great to see that even in the times of hardship, there are so many positive outcomes And we can learn a lot in building more inclusive environments, tackling stigma, and promoting recovery. It's been fantastic presentations and discussions, and as always, it's difficult to end on time because I'd rather we go on and discuss this further. And it's equally fantastic that we've gathered so many different partners and participants from across the globe, and both from civil society to policymakers and people working in different areas of our field. This truly shows that we can come together in these times across borders, time zones, and scopes. And in the words of a good friend, I too believe that recovery truly thrives by connection between people. Recovery is connection, and connection is recovery. And that's something that we've heard today. And in this time of the pandemic, it's not only shown us the perseverance of people in recovery and by those working within this area, it's also proved time and time again that we can all learn a lot from people in recovery. So as our panelists have so graciously shared both personal and professional experience, my deepest appreciation for all of you and what you do on this issue in driving policy change, creating safe spaces, promoting the message that recovery is possible, and celebrating people in recovery. So with those words, on behalf of WFAD and all of our fantastic partners today, thank you to our panelists, and thank you to all the participants for being here today.
Thank you, Regina. And thanks, everybody. Take care. Thank you.
Take care, everyone.
It was a pleasure.
It's been a true pleasure.
Thank you.
Thank you.